very good evening to everyone. For more than a year, due to the COVID pandemic, we have faced a lot of turmoil, be it the loss of near and dear ones, loss of job, health issues, or lack of social interaction. The toll it has taken on our health is profound. Stress levels have increased manifold, and in this scenario, taking care of your heart is very vital to improve our overall health. It is the powerhouse of our body. It keeps all the organs functioning properly. So, we welcome you, ladies and gentlemen, to this exclusive session on cardiac care in association with Prime Medical Center on the occasion of World Heart Day. This session will be conducted by Dr. Saurabh Arvind, specialist cardiologist at Prime's Medical Center, Sharjah, and he will be joined by Mr. Fahad, who is the social media in charge of Prime Medical Center and who will be the moderator of this webinar. We also have our principal, Mr. Arogya Reddy, in our midst. I'm sure this session will be an enlightening one for everyone. And if you have any queries or questions, please do post them in the chat box or the comment section. So without much ado, let me hand it over to Mr. Fahad.
Thank you very much, Ms. Shanti. That was a wonderful introduction. Well, a very good afternoon to all our viewers who are watching us on our YouTube channel. It's always great to have an opportunity for Prime Healthcare Group to spread the awareness on all the healthy topics that we could cover. As we know that we have just gone through the World Heart Day that was on 29th of September, and this is a very, very special webinar that will be related to the same. Heart is the one of the most important organs that we always look forward to, because the blood supply is definitely directly synced to it, and we've got really we need to understand that heart has a lot to do, not only within the body, but we have to manage it with our lifestyle changes, and there are so many other things that we are going to look into that. And of course, we have an opportunity to discuss it today with our specialist cardiologist, Dr. Saurabh Arvind, who has an extensive experience of more than 8 years and has been practicing in Prime Medical Center, which I should say Prime Specialty Medical Center in Sharjah. So today we're going to talk about all the issues related to heart. If you have any issues or any concerns that you have in your mind, please go ahead, write it down in the comment section, and I will read it out to the doctor, and Dr. Saurabh will cover it for us. So, Dr. Saurabh, without any further delays, thank you very much for joining us out of your busy schedule. Talking about an important topic, Doctor, we'll be looking forward on the cardiac care, the care that we really look into, and that's the reason we have dedicated a day to it, World Heart Day. So, we would love to hear from you. Thank you very much.
Thank you, Mr. Fahad. First and foremost, good afternoon, everyone. I would like to thank the Ambassador School for giving me this opportunity. It is an absolute honor and privilege to be speaking live on this platform, addressing all the young and the bright minds of impressionable age, and guide them and maybe help them towards a cardiac better health. As a student, I always hated this kind of speech slash monologues, and I would also like to keep my monologue very short and maybe a more informal, and would like to address the queries or the live questions, whatever which you have regarding health issues, heart issues, and bring it on. While we were discussing the topic for this, we initially thought that maybe we would like a more specific one, like talk about hypertension or maybe talk about cholesterol issues that many of the people face. But then we thought we are keeping us restricted to the topic, and let's just address the every heart issues that most of the people face. Address very simple queries that most of us have, like what to eat, what not to eat, how to change our eating habits, the exercise lifestyle changes, that everything needs to be done. And that's what I would like to discuss over here for a few minutes, and then we can take the questions and queries if we are. Basically, it's a continuum where of a healthy body and a healthy heart continuum, wherein a healthy heart resides in a healthy body. Keeping our body healthy means having a good eating habits, having a very good lifestyle, avoiding all the bad foods, the what you call bad foods in the sense the fast foods, doing good exercise, a moderate amount of exercise, all that things which makes our body cells regenerate and grow. That is the thing. So basically, cardiac care is a very broad, multifaceted field. It's a multidimensional field. Uh, there are certain risk factors. There are certain things which we can do. There are certain things which we can do to avoid us having the health problems. We would like to go that there one by one. So there are few things that everybody, every person has some genetic factors which basically makes us susceptible to certain heart diseases. We have to call them that. That is not your fault. Basically, we are a spectrum of a genes of our father of our families. Okay, there are some form of genetic issues. There are some form of genetic mutations that makes us susceptible to having a heart disease like blood pressure, having a cholesterol issues. Okay, having obesity. These are something which are not in our hand, which is not in our control, and we can't do anything about it. But there are plenty of other things, plenty of other risk factors which are modifiable, which we can certainly uh, change, certainly adopt a healthy way of living, which can help us. So I would like to discuss that. The first and foremost is, I think, because we are talking to the young children over here, I would say the first and most important thing is smoking. Smoking of any form, be it e-cigars, the vape, which is quite a craze nowadays. The e-cigar companies are promoting it as a healthy alternative, while it is not. Uh, the smoking in any form, like I said, be it vape, be it e-cigars, be it cigarettes, be it hookahs, okay, or the shisha, none of them is at in any way beneficial to us. The promotion by the vaping companies that it contains nicotine or it doesn't contains any impurities is completely and utterly baseless and wrong. The vaping uh, contains approximately 10,000 times more nicotine, okay, than a smoking, than a cigarette. Cigarette itself contains so many hydrocarbons which are cancerous and which can not only affect your lungs but are affected with lots of cancer. Okay, the smoking leads to hypertension, smoking leads to heart attacks. Most of the patients that we see are young people, right from the age of 20 years to 40 years, who have no other risk factors apart from smoking. The only thing which they had was they were smoking, and they suffered from a massive heart attack at such a young age. So that's the most important thing. Do not smoke. Second thing which I would like to address is our eating habits, our eating lifestyles. Okay, basically our body is what we eat. Okay, uh, everybody knows that. I think it has there has been enough promotions about the fast food, that the pizza, burgers, French fries, they are the absolute worst form, and we should avoid them. I think everybody knows that, and that is not what I'm here to talk about. What I want to talk about is how we can actually make a conscious effort to reduce these things, to try and adopt a healthy lifestyle, especially the healthy eating habits that we can do. So here are few pointers from my side. Some of them may sound really stupid, some of them may sound really naive and some weird, but I do believe they help us in these things. So first and foremost is that we eat whole grain things like cereals, mueslis, and other things. These are good, and try to eat it as less refined as possible. More refined food is more refined, the more chances of it having complex carbohydrates, okay, which are not good. Second thing, this is a from personal experience and other thing, we should eat our fruits rather than drinking them. What I mean to say is, having all those commercially available fruit juices, they are not good. They contains lots of preservatives, they contains lots of sugar, and even though they claim it is no sugar and other things, that is not the fact. So it's better to eat our fruit rather than drinking them. Okay. Instead of doing grilling or frying our foods, if we can bake it or roast it, that is better. Okay. Another pointer that I would like to give is the dry fruits. As I would like to say, go nuts. Basically, eat cashew nut, walnuts. Okay, all those things are really good. They contain lots of serotonin, lots of antioxidants, which are good for our brain. Okay, eat salads or the fruits. Okay, especially the salad part. If we can eat our salad in the beginning of our lunch or your dinner, that is really helpful because it fills up our stomach and it also helps reduce the absorption of the carbohydrates from your diet, which are good for our body. Okay. Another thing, this is a stupid one, if you can consider it, that never go to a shopping to a grocery store without taking a list. Purchase only those things which you have made it in a list, which you think are essential, and not because just because you can see them on the display over there. Okay, that thing is really bad and counterproductive, and at times we do impulsive shopping just because something is available on discount or something is available on 2 plus 1 free, even though it is not at all healthy for our life. Okay, so these are something about the eating part. Next, I would like to talk about is basically the exercise. As we again, it has been promoted multiple times. There are so many internet articles, there are so many internet videos on newspaper, radio, everywhere. Everyone talks about is doing exercise. Okay, uh, doing, even if you do can do just exercise for say even 3 days in a week. Okay, even that is helpful to us. Even if you do just 15-20 minutes of moderate intensity exercise, okay, that helps promote uh, antioxidants, that helps burns fat, and that provide regeneration of the muscle cells, which is good from a cardiac point of view. It helps regenerate our dead cardiac cells. Okay, so that is good. Exercise, especially the cardio part, like the cycling, like swimming, like doing a cross trainer, the treadmill, all these are very important. Even if you do it just for few minutes, there are plenty of YouTube videos available wherein you can even search the exercises to which we can do at home. Okay, using just watch it live on a YouTube and do it, do even those things, doing it even 10 minutes, 15 minutes daily comes a long way. What we need is a really good consistency in doing the exercises, and that helps. Okay, another thing that is like about the blood pressure part, about the cholesterol part. Okay, is the stress management. We are, it's a very stressful life. We are exposed to so much of the online stress, the stress on the television news, all those with the political spectrum part of the news. Okay, the personal life, the professional stress, stress of education, stress of exam, the career choices, everything. There's so much stress out there. Okay, so stress management is one thing that we can really help us in having a good and healthy heart. One of the ways, there are plenty of ways. Listening to music, it helps quite a lot of people. Exercise is one of the ways of reducing exercise basically releases the hormones in our body that modulates our mood, which is basically a serotonin and norepinephrine. Okay, and it elevates your mood. So exercise again helps in stress. Okay, then again, reading is a very useful form of stress management. Like I said, some people like to listen, reading religious texts, reading novels, reading non-fiction, fiction, anything that basically keeps us divert from our mind. Reading for few minutes before sleep is a very good habit. It gives us a very nice and a sound sleep, and it helps keeping your heart healthy. Then the lastly and foremost about the like the blood pressure part and the cholesterol part, they are quite mixed up. Everything depends basically. Most of the things are our diet dependent and lack of exercise, which is leads to all those things. So doing regular exercise, again, I'm stressing on that fact. Okay, reducing less salt, eating less salted food, reducing salt, making it a pink Himalayan salt instead of using a normal salt, replacing oils in our food to instead of normal oil to switching to a, maybe a soybean oil or a canola oil, which is contains high contents of omega 6. They are good. Okay, all these are small things. Then there's probably a lot of queries about the various diets that are available nowadays, like intermittent fasting, the keto diet, the Atkins diet. Think most of the people, what they do is they follow a particular diet. Suppose, say, if they are planning a intermittent fasting, they do it for 2 months, 3 months, and they give it up. So that's not how it should be. If you're planning to something, you're sticking to a diet, you have to follow it religiously, you have to follow it very regularly, for at least 6 months, a year, and it is only then that we get a good result from it. I think I have covered most of the topics. The other thing which I would like to talk is people's hesitancy on relying or using the various medicines which are available, okay, for managing these things. For, like, we have plenty of options for managing the cholesterol, we have plenty of medicines for managing the blood pressure, and many people, many patients, young patients who come to me are very hesitant about it, that they don't want to take medicines, they want to try all the other things, but they don't want to take medicines, which I think, while in itself is a good thing, that we are trying to change our lifestyle, but medicines do help. Medicines help not only in making it easier for you to follow those lifestyle changes, but they also reduce the immediate risk of having those high blood pressure or having a high cholesterol. So, if your doctor suggests a medicine, please discuss everything with your doctor, all the available side effect, whether you would be dependent on it, whether if you stop the medicines in the future, would your body respond in a harmful way? Would there be any rebound phenomena because of it? But please make a very conscious decision. Please take a very knowledgeable decisions about all those things, and only then you decide whether you want to take a medicine or not. Again, then the last thing, the all the available, I think the most important thing is that we should not smoke. Whatever happens, it's the worst, absolute worst form of addiction. All form of drugs, like crack, cocaine, heroin, okay, these are known to cause heart attacks. People suffer from plenty of events because of this, and then they suffer from a very major heart attack because they are onto these drugs. Similarly, with smoking, okay, there are plenty of ways of helping people reduce smoking. There's absolutely no way that people, we cannot stop smoking. Okay, there are nicotine chewing gums available, there are nicotine patches available, there is psychiatric counseling available, then there are various medicines also available which help us quit smoking. And if someone is addicted to it, we should definitely go on and take a professional opinion if required, but smoking quitting is something that is an absolute must. Okay, then again, about the eating part, like I have already mentioned, the pizzas and the french fries, these are really bad. The bread, instead of using a normal bread, maybe if we can use a whole wheat bread, the brown bread, that is nice, that is helpful, instead of using frying or doing, maybe we use a roasted food items. Then all these things, these are small things, but they are very helpful and they help us and guide us in all those things. Another thing that comes in the part of a cardiac care, like the cholesterol management. uh, the cholesterol management, again, there are some hereditary factors at play in cholesterol, which makes you susceptible, or which makes you vulnerable to having a cholesterol illness, having a high cholesterol, basically not an illness as such, having a high cholesterol from very young age. Okay, again, that is not something to be worried about. Okay, that, don't get alarmed, don't get very anxious about it, don't get very worried about it that you have a high cholesterol. It's very much manageable, but you have to follow certain diet and lifestyle changes, and take medicines if available. Having a cholesterol illness, having a high cholesterol in your family members, in your parents, in your grandparents, either maternal or paternal, or even on having cholesterol issues in your siblings, makes you at a high risk of having those cholesterol issues. So that's why a regular heart checkup, regular checkup of your cholesterol, regular checkup for sugar levels, doing regular echo and doing a treadmill test, the exercise stress test, subjecting your heart to a stress and seeing how it responds can help us detect the cardiac diseases at an earlier stage before they can cause any permanent damage or a permanent harm to a heart as well as to other body organs. It's a very like a continuum spectrum, like blood pressure. High blood pressure affects not only your heart, it also affects your kidneys, it also affects your brain, and also affects your eyes. Similarly, effect of blood pressure on kidneys damages the kidney, which again resists the blood pressure, which again affects the heart. So all these are basically a vicious circle kind of a thing. And if we can catch the problem early, it helps following, and therefore it can guide us to a very healthy life. Nothing is there that with the help of modern diagnostic techniques and modern medicines that we cannot achieve a reasonable level of control and a reasonable level of life healthy and a good productive lifestyle, even if you have some of the heart diseases. For the patients with who have heart attacks, or patients someone who had suffered from a heart attack in the past, okay, there are plenty of medicines available which help us live long, which help us live a very productive lifestyle, okay, following a good exercise regime, following a good uh, dietary protocols, okay, they can live a very healthy and productive lifestyle. Okay, so that is not something which is to be disheartened about. We can have a good and a really nice life even with having these heart diseases, is if we follow certain proper rules and precautions. I think Vahab,
Sure. Thank you very much, Dr. Saurav. That was
we can take any
very,
queries if we have some of the
yeah,
questions.
yeah. I would like to take it forward from here. It was very well presented. The detailed information that you've given. Thank you so very much for that. I would like to, Doctor, ask you a question related to, we've talked about lifestyle, of course, in your talk. Uh, there are people who have high blood pressure or high number of cholesterol levels, but with the passage of time, by after taking medications, it comes down to the normal values. All right, and then the question comes in here that a lot of them leave the medication once the blood pressure levels are normal or the cholesterol levels
Exactly.
are normal. They leave it. So is it a way, is it the right way, or even after the values are normal, should we still keep on taking the medications, because of course there is always a side effect on the other side of for the medications also. So what do you have to say on this?
Excellent, excellent question, and one of the very common queries of the patients is this. So yeah, so basically it depends not only on the current status of your blood pressure or the current cholesterol levels, but also depends on what was the previous values of the, suppose the blood pressure was 180 initially, and now with medicines it is controlled 130, 140. So should we stop? I would say no. If the initial blood pressure was 180, if we had some treatable cause, like you were under a lot of stress, other personal professional life, and that stress level has been reduced, you have been able to identify the stressor and treat it or remove the stressor. Yes, then we can think of actually stopping the medicine for the blood pressure. Monitor, we should be able to have a very good monitoring of the blood pressure, and if we can keep a good track of the blood pressure, yes, we can give it a trial, but it has to be very well monitored and regulated. Similarly, about cholesterol, the thing about cholesterol is it is not something like a malaria or a dengue that if you have something, you take treatment for 5 7 days and it goes away and then you don't need treatment for it. Cholesterol is something that stays with us for lifelong, and we have to take medicines to make it under control. And after that, if we follow a really a good diet pattern and do a regular exercise, weight loss, and all those things, yes, we can stop the cholesterol medicines. But then again, it does needs monitoring. It also depends on having, if you have any other risk factors. See, basically all those things are interconnected. Having a blood pressure, diabetes, cholesterol, okay, then family history, then are you a smoker or a past smoker? Like suppose if you are a smoker and if you have a cholesterol, there are say 1 in 20 chances that you will have a heart disease in future. But if you are not a smoker, then there is a 1 in 40 chances. Similarly, if you are an ex-smoker, if you have smoked even one cigarette in last 5 years, the risk is 1 in every 10. That's how it is. So it depends on many factors, not only on your current cholesterol levels, what is the whole risk benefit ratio of taking this, what are the other risk factors which you have, and depending on that, we take a call on whether we need to continue the medicines for lifelong or if we can stop it. If we do stop it after taking, say, a 3 months or a 6 months course and are able to achieve a good control, we should definitely recheck it after, say, 2 3 months, every quarterly or every 6 months. Keep a good tab of it, keep a good monitoring of it, and if the cholesterol levels rises in the further, we can definitely restart it.
Great. Thank you so very much, doctor. Doctor, I've got a question here. The question is from Mr. Sharan Kumar. He says, "Hi, doctor. How to reduce bad cholesterols?"
Yeah, okay. Hi, thank you, Sharon, for the question. See, the LDL, that is known as the bad cholesterol, and the HDL is known as the good cholesterol. That is like what has been advertised and publicized everywhere. But it's not like that. Even the LDL, that is the bad cholesterol. That is our most important. Having a high LDL, HDL cholesterol, the good cholesterol is a good thing, but our main aim is to reduce the bad cholesterol. That is the LDL cholesterol. There are, the first and foremost thing is, like I have already mentioned, having a good lifestyle. So avoiding all the fatty foods, avoiding all the synthetic sugars. That means the chocolates, the cold drinks, the fast foods. That helps. Doing a regular exercise, as I have already mentioned, for say even 15 to 20 minutes daily or half an hour, even for 3 or 4 days in a week, and maintaining it. That is the most important thing. That most of the people, when they come to us, they have high cholesterol, they are extremely motivated, little bit scared, and therefore they, for initial 3 months 4 months, they are quite good with the diet restrictions, they are quite good with the exercise regimen, but after a few months they just lose the motivation and then go back to your previous lifestyle. So that is the most important thing, that you have to maintain and follow the diet precautions, the dietary restrictions for a considerable amount of time, for a with very good and a balanced exercise approach. And if these things doesn't help, then we do have plenty of medicines available for reducing the cholesterol, but that is not our first aim. Our first aim is to try and reduce it with the help of diet and exercise, and then the medicine takes its role. Again, if also depends on what is the initial cholesterol level. If the initial bad cholesterol, that is LDL, is very high, we would start you on medication start from the day one. Along with that, your exercise and dietary changes, and then keep a good monitoring, and then we can reduce the doses or even stop it or make it alternate day. That's how the things work. And if it doesn't, we are not able to reduce it by one medications, there are other medicines which are also available, we can add. There are some newer medicines which are also available for very high cholesterol levels. There are some injections which we give, monthly injections, which has shown some very good results in people, and that reduces the cholesterol. So there are plenty of options, and that is the way we can reduce the bad cholesterol.
All right, thank you very much, doctor. Doctor, I was about to connect our today's session with diabetes, and already got a question from Miss Nancy Francis. Will diabetes affect heart? A very important question, I believe.
Of course, of course, of course. See, like I have already mentioned, it's a whole continuum, and all of these things are connected. So, if your diabetes, apart from affect because of the high sugar levels, it affects the small blood vessels of our body, not just the heart, but every small blood vessel. So, these small blood vessels supply to the nerves of the heart. So, a diabetic patient will not feel a very painful if he has a heart attack. The pain would not be carried because the nerves are dead. That's how the diabetes, that is one of the reason why diabetics have so many silent heart attacks. The diabetes affects the large blood vessels also, because if diabetes is not well controlled, our cholesterol level goes wayward. The cholesterol levels tend to be very high, especially the triglyceride part, which gets deposited inside the arteries and it blocks the arteries. It decreases the size of the arteries, therefore the heart doesn't receive proper blood, and again it affects the heart. Diabetes all leads to formation of various molecules, because which are highly oxidants, which are highly metabolically active, which are highly reactive species, which leads to generation of lots of harmful products, which have a very direct effect on the heart, and it reduces the functioning of the heart. So that's why diabetes affects kidneys, so it leads to high blood pressure. High blood pressure affects heart. Okay, again the high blood pressure affects heart, that again leads to kidneys. It leads to decreased diabetes medicines and decreased effect of medicines, all those things. So it's all whole continuum, and all are very much interconnected, and there is various interplay among various hormones between the diabetes and the heart. The good control of diabetes will definitely help us reduce the heart diseases, the cholesterol level, the blood pressure level, and even a good effect of heart diseases. A good control of blood pressure will definitely help us reduce the chances of us having a diabetes in the future if we don't have it.
Great, thank you, Doctor. Doctor, moving on towards the next question that I have here is from uh, Mr. Arogya. Pardon me if pronouncing your name wrong. Please suggest some good remedies for controlling cholesterol and BP.
Yes, yes, yes. So, see, the home remedies, one of the most important home remedies, like I already mentioned, is having a very good diet uh, following. Okay, so we should avoid the red meat part. This is, although it's not a remedy in the sense, but yeah, so that comes in the management of the cholesterol and blood pressure is avoiding the red meat. It contains lots of saturated and unsaturated fats, which is not good. Okay, avoiding too much of oily foods. Okay, that is also one of the way. Avoiding too much of oily things. Okay, avoiding salt. Okay, reducing the salt, one of the most important way of reducing your blood pressure. Okay, if you say, even if you reduce 1 or 2 grams of salt in your diet, okay, it helps reduce the blood, it reduces the blood pressure by 20 millimeters of mercury. So that is amongst the very good way. If you can use a alternative to a normal salt, because normal salt that we use is a very highly refined one, it contains lots of sodium. So instead of that, if we can use a pink Himalayan salt or the rock salt, okay, that is less refined, it contains less sodium, okay, that is helpful. Then eating lots of using garlic, eating garlic, that is a good way of controlling cholesterol and blood pressure. So if we can eat just 1 or 2 pieces of garlic early in the morning, empty stomach, okay, so that helps in the blood pressure part. Then reducing the, changing the oil that we use for cooking, maybe using the olive oil or the extra virgin olive oil, or using a canola oil rather than using the coconut oil or our rice bran oil. That helps. It contains a good amount of uh, omega 6 and omega 3, which are good for cholesterol. Okay, that helps. Eating lots of fruits. Okay, so eating potassium rich fruits, so like banana, that is helpful. Drinking coconut water, that contains lots of potassium, that has found to have a very good effect on your blood pressure. Okay, uh, and all those things helps in the blood pressure and the cholesterol part.
Thank you. Thank you so very much, Doctor. I've got another question from Mr. Bina. Good evening, Doctor. How often should we administrate an overall checkup for the heart?
See, it again, for I would recommend, there is no universally guidelines or universal recommendations on it. But say once you are above 40 years of age, you should definitely check for the blood pressure, for the cholesterol, for the diabetes part every yearly, and should get done a stress test, that is a treadmill test, ideally every yearly, or at most two yearly. But however, if you are a smoker, if you have a family history, if someone in your family has a heart disease, someone in your like up to second generation, that means your grandfather, maternal, paternal, or your uncle, they have a history of a heart disease, we can even go early and maybe start from 35 years of age and get it checked ideally once every yearly. Even thyroid checkup should be done. Thyroid diseases is affected with cholesterol levels, high cholesterol levels that can affect. So maybe ideally after 40 years of age, definitely every yearly. And if more than 35 years of age, you should can do if you have certain risk factors. For someone who is a smoker, for someone at young who have a family history of say a heart disease or a sudden death, sudden cardiac death kind of a thing, they should do it even early, say after 21 years of age. Someone who is involved in lots of strenuous or physical activity, someone who consumes say steroids for bodybuilding and other things, they should also do it at an early age and then continue it every year.
Thank you so very much, Doctor. Uh, just to let you know that we're getting some good appreciations coming in from the viewers. It's a very useful, in fact, session going on. Doctor, I've got a question here from Mr. Lee Ju Sebastian. And the question says, Hi, doctor, can you please suggest how to identify heartache? Is it gas related or stroke related?
Okay, so see, there are few pointers. There is no such like one shoe fits all kind of a thing in relating to chest pain because of heart disease. But definitely, if you have a heart attack or the chest pain would be very severe. Okay, you would there would be sweating, there would be perspiration, you would feel very much restless. Okay, the pain would be either from your neck to your stomach, it could be anywhere. So having a stomach pain doesn't also rule out a heart disease, but a heart pain is usually one which is very severe, associated with sweating or breathing problems. Okay, that is something which is heart related. The other form of chest pain, which is because of a heart disease, is one which comes and goes on doing some exertion. So, like if you are climbing a staircase, or like if you are walking very fast, you will feel some heaviness in your chest, or you will feel some chest pain, or you will have some breathing discomfort while lifting heavy objects. Okay, and then once you take a rest or reduce the speed, you will feel better. That's how pain of a heart disease comes. Another thing is if you are walking very fast after eating foods, okay, immediately after eating food, and then you can have a pain that is angina kind of a pain, and that is related to heart. However, if you are having a pain in the chest, which is say 30 to 40 minutes after you had your food, and which gets better after burping, or which gets better after passing the flatters or gas, then that is usually not heart related. Again, the pain which comes for very few seconds, okay, like say if the pain is only for 5-10 seconds, that is usually not heart related. A pain which is there for many hours or many days, that is again usually not heart related. But ignoring any kind of chest pain is not good. Whenever you have chest pain, if it's there and it's bothering you, it's better to get them at least an ECG just to rule it out. Because, like I said earlier, also the diabetic patients, they don't have that much pain sensations and they tend to suffer from a painless heart attack. Similarly, some of the patients who have a heart disease will not have chest pain also, and rather they would feel just some backache, like in the shoulders, between the shoulders, or sometimes just stomach ache. That's how also sometimes the heart symptoms can present. Uh, so there are wide variety of presentation of a heart disease, but like commonly the chest pain is either one which is very severe, which you will not tolerate, that is heart related, or something which comes and goes on doing some exertion, like even on bending forward, if the chest pain comes, that is also heart related. Okay, a chest pain while like if you are sleeping and there's a chest pain which is not very severe, then usually that is not heart related. If it's the pain is more pain which if it increases on pressing, you can pinpoint a pain, or if you can say that if you press on the chest and the pain increases, that is more likely to be a muscular pain rather than a pain of a heart disease.
Perfect. Thank you. Very well explained, doctor. Detailed information. I'm sure that answers the question. I've got the next question coming in from Mr. Satya Priya. The question says, does stress level affects the heart, doctor?
Yeah, of course. See, the stress level affects heart in a many ways. Most of which important is that uh, our body's flight and fight response is basically concerned with the enzyme or a hormone called adrenaline. Everybody have heard about adrenaline. It is something that quite commonly used jargon that causes of adrenaline rushing. Okay, so adrenaline is basically a hormone that increases in response to a stress. So the adrenaline basically what it causes is it increases the heart rate. One, it increases the contractility of the heart. Okay, it increases the blood pressure. It increases the sugar level. It increases the cholesterol, especially the bad cholesterol level. So all these things, okay, with the stress level, it affects your heart, it affects your blood vessels, and it affects our kidneys also. So definitely the stress. That's why stress is a very important. Managing stress is a very important aspect of having a healthy heart, and it's a very important aspect of a cardiac care spectrum. Uh, there's so many, we are seeing so many young patients, say around 20 years, 25 years, even someone 16, 17 years who are going through stress in their life, either professional level, professional, personal, whatever it is, and they are suffering from heart disease, they are suffering from high blood pressure, okay, they are suffering from palpitations, they get these panic episodes wherein there's lots of sweating and there's breathing problems, there is increased blood pressure for half hour, 1 hour, and which the reduced stress level it goes down. That's why stress
Understood.
management
Mm.
is a very important part. Doing activities which help stress can go a long way in having a healthy heart.
Sure. Thank you, Doctor. Doctor, an important question again for a layman person to understand. The question is from Miss Anusha. Doctor, how different is triglyceride and cholesterol? I mean, what is the difference in both?
See, basically, cholesterol, triglyceride is a part of a cholesterol. Okay, it's a component of cholesterol. Just like the cholesterol, we can calculate total cholesterol. So triglycerides is a part of it. The cholesterol is divided into various components. Like everybody knows about the LDL, which is a bad cholesterol, and the HDL, which is the good cholesterol. Similarly, triglycerides is that one part of a cholesterol, and it is basically a bad cholesterol in that it is not as closely, it's not, let's just say it's not as bad as LDL, but it's definitely a bad one. And people with high triglycerides level have a earlier onset of high this heart diseases. People with thyroid and people with very poor control of diabetes tends to have very high triglycerides level. Similarly, people who have their pancreas affected, okay, they have triglycerides level. Even triglycerides can cause very severe pancreatitis, that is basically inflammation of your pancreas gland, and that is a very severe condition. Okay, but basically considering everything overall spectrum, triglycerides is an cholesterol, but it is not the LDL or HDL component, but a very different component, which is again implicated and is responsible for a heart disease.
Perfect. Thank you very much, Doctor. Doctor, moving on towards another question, I have Miss Padmavati. She has asked a question. Good evening, Doctor. Please suggest how to take garlic in the early morning. So I think you need to tell us how do we take the garlic, or maybe
So basically, just
for
take
people to understand that. Yeah.
one or two small pieces of a garlic, and you can just swallow it directly with water, okay, or cut it in small pieces, and you can even chew it. But I think chewing would be an issue because of the taste and because of all the smell that comes because of the garlic. So better to take just one or two small pieces of a garlic, uh, and peel it open and just swallow it as a capsule. I would that suggest that's what I suggest. You just swallow it, consider as a tablet, and just swallow it early in the morning, empty stomach with a glass of water.
Right. Thank you, Doctor. Doctor, another question from Miss Nancy Francis, and the question says, "Hi, Doctor. Good evening. Can you please explain on chest pain caused after blowing balloons?" So somebody's having a chest pain after blowing the balloons.
That's a very specific question. See, it depends on the type of chest pain that you are having. Like, if it is repeatedly causing only after blowing balloons, so it could be because of an heart disease because you are straining while blowing balloons. Okay, so that puts a stress on your heart, and otherwise it could also be because of some issues related to the chest muscles because that would be involved in blowing the balloons. uh, but I think more or less, if it is occurring repeatedly only on blowing balloons, uh, just rule out, get done a ECG or a treadmill test to rule it out, because that is basically a stress induced. It's a repetitive stress that is causing that pain, and it can be a heart related disease.
All right, thank you very much, Doctor. Doctor, we know that we all are lucky enough that we all are the residents in UAE, and we should appreciate the way the government has really tackled the
Yes.
COVID situations in our country in UAE. So, my question related to COVID-19, as we are coming out of the pandemic, probably that we've started the expo here in the country, Doctor. This is there is no doubt that COVID has affected a lot of people. Now, when you talk about chronic patients, obviously cardiac care is a part of it. So, how do you see the COVID-19 affected the has affected the chronic patients, or is there any new, taking care that a person should take as we are into the new normal?
Yeah,
Or
I
how would
think
you relate COVID-19 with that? Yeah.
the first and foremost thing is like wearing masks, maintaining social distancing, frequent hand washing. All those things are the way forward moving. Okay. Second thing, get vaccinated. There is absolutely no reason why anyone should not be vaccinated. You are having a heart disease, you are having a lung disease, you are having a cancer, you are having blood pressure, cholesterol, anything. Okay, there is, you have to be vaccinated. That is the most important thing. In fact, if you are having a heart disease, say a blood pressure, or even if you had a heart attack in the past, you have a stent placed, you underwent a bypass, you are having high blood pressure, anything, okay, this puts you at a increased risk of having a complication because of a COVID. Okay, so you should take the vaccine even earlier. Okay, that's why initially the vaccines were given to people who were at high risk of having these diseases. So there is absolutely no two doubts about it. Vaccines, hand washing, mask, social distancing. Now, how it has affected people with heart disease or people with any chronic illness, like even lungs, like having COPD, people having asthma, their lungs and their body is already compromised. Okay, their body is not that well able to cope with the stress or the pressure of having a illness. Okay, so the compensatory mechanisms that is required by the body, that is not very well, uh, say very well developed, or it has been overused because of already having a heart disease. So these patients are at high risk, and that's why most of the patients who get seriously ill because of a COVID are someone either of a older age who have a lower immunity and have compromised body functions, or someone who has a chronic heart disease or lung disease or liver disease or even kidney disease. That's how it is. Some of the few young patients who are quite young, we have seen those who have recovered from COVID and who had a higher blood clotting tendencies because of this COVID issues, and therefore they underwent a clot in their lungs or they had a clot in their heart. Again, those are quite few, very rare. Okay, but yes, that has been there. The COVID induced stress has also caused lots of people to have a high blood pressure, have a high cholesterol levels. There have been many people who have been diagnosed with diabetes post COVID because of the stress associated with the COVID illness. There have been people who have persistent weakness or persistent chest pain, having persistent breathing issues post COVID. Their lung function has not been recovered completely because of the COVID effect. So there are lots of effect of COVID, but more or less in most of the patients we have seen that patients, maximum patients are able to recover fully and continue with their life as before, and that's it.
Thank you, Doctor. Another question from Mr. Alicia Sebastian. Doctor, how to identify any heart-related diseases in the children, especially in faints and kids under 10?
Okay, so the heart diseases that comes in the children group, especially like you said, the infants or the children who are less than 10 years old, are little bit different from those that affected in the adults. Like the blood pressure part, the cholesterol part, they are very rare in children. What they do have are something called as congenital heart diseases. That is, there is an issue in the development of the heart since birth. Okay, so they have a congenital heart diseases. Uh, they vary from being very asymptomatic and having no symptoms at all to being having less oxygen right from the birth. So we tell them as blue baby, that is known as blue baby syndrome, very commonly used name. So these infants or these children become pink on doing, like especially infants if they are, so while they are being feeding, so they become blue because of the stress on the heart, because there's a mixing of the blood in the heart chambers, there's a hole in their heart, there's a problem in the blockage to the blood supply to the heart, all those things. So basically, they have a very different manifestation. Most importantly, is that they will have frequent incidences of lung infections, that is known as the LRTIs or the URTIs, the lower respiratory tract infection. That simple cold. They would have frequent episodes of a cold. They would not be able to gain weight. They would get tired easily. That means that if they are playing with children of their same age, they would not be able to play with them, or they would get very tired easily. They would not be able to run that much, and they get blue on doing some strain. Like if they cry a lot, they become blue. If they run little bit, they become blue. So that is most of the manifestations of heart diseases in children. Some of them may have blood pressure, and some of them may even have a heart failure and other things, but that is extremely rare and not seen that frequently. Okay.
Perfect. Thank you. Thank you very much, Doctor. Doctor, taking another question, I believe I should. This will be the last question of our webinar. Ms. Raji has asked a question: is congestive heart attack curable? Heart disease. Pardon me, doctor.
See,
Heart
the
disease.
congestive heart disease basically depends on the cause of the heart disease, of the congestive failure. So if it's because of blood pressure, patient has developed a congestive heart disease. So if we cure the blood pressure, if we keep the blood pressure under control, not cure as such, if we keep the blood pressure under control with medicines, definitely there are less chances of patients having a repeat episode of a congestive heart disease. If it is because of diabetes, okay, if the heart's functioning is reduced because of a diabetes or because of a kidney disease, usually it is not curable, but it is treatable. That we can keep the symptoms under control with medicines. Similarly, if a patient has a heart attack because of which heart's functioning has reduced, so again same thing, the patient may sometimes have a repeated episodes of breathlessness, few episodes, and but more or less they can be managed well with medicines. If the underlying cause of a heart failure is because of a thyroid disease, or if it's because of some infection, only these things are curable, in the sense these are reversible, not curable. But if we get the thyroid part corrected, or if the infection is treated, the heart function can come back to normal. But if it's because of a blood pressure or a kidney disease or a heart disease, heart attack, or diabetes, those are manageable and treatable but not curable.
All right, doctor. Thank you so very much for all the information that you've given probably in the past 1 hour. Lot to learn, a lot to understand, and of course, the people who have been into the webinar or who will be watching us later will be definitely getting a lot of benefit out of it. Doctor, thank you so very much once again for all the information that you've given. Thank you to in fact, organizers who have really made this successful, and I'm sure to all the parents out there, to all the teachers, to all the subscribers of our channel here, would be having a very very informative session today that we've done today on the cardiac care. So thank you very much, everyone. I'll be handing over the session back to Ms. Shanti so that she can conclude. Thank you very much.
Thank you, Fahad. What an informative session it was. Thank you so much, Dr. Saurabh, for giving us such valuable information and all the useful tips on cardiac care. Indeed, we understand now the risk factors and the lifestyle changes that are required to maintain a healthy heart. And it's up to us to follow your advice and not procrastinate, because we always begin in very good faith. But like you mentioned, after a few months, we tend to get lax. We slow down. So we should know that health is the true wealth for everybody. And we would like to thank Prime Specialist Medical Center for facilitating this session. Also to Mr. Keba for coordinating this, as well as Ms. Ledwina. We're happy that parents and teachers took the time off their schedule to attend this session. I'm sure you must have really enjoyed it and gained lots of information. Thank you once again, everyone, and have a good evening.
Thank you so much.